Hello everyone, welcome to Is Pharmacology Difficult podcast, and today we are going to continue with our crash course sessions. I know they have been a little gapping, but without any delay, let's get started. Now we have to do sympathetic nervous system. Now, what we need to know most importantly that noradrenaline is the neurotransmitter at most of the sites. How to get to know about the synthesis of noradrenaline, about all the steps of the synthesis of catecholamines. Let's get into little nitty-gritty details. The circulating tyrosine, it is transported into the cytoplasm of the neuron, and there it is hydroxylated to form L-DOPA. What do you mean by saying DOPA? DOPA is a short form of dihydroxyphenylalanine. Then this is kind of a rate limiting step, and this particular rate limiting step, it is catalyzed by an enzyme, tyrosine hydroxylase. That is very important. This tyrosine hydroxylase can be inhibited by another drug, that is metarosine. Now, metarosine can be used to control the discharge of catecholamines, especially during the surgical removal of the tumor in the patients who are suffering from the pathology of pheochromocytoma. So that is the use of metarosine. Got it? Now let's come to the another part. L-DOPA. What happens to L-DOPA? It is converted to dopamine, and that is acted upon by non-specific decarboxylase. This decarboxylase is also used to decarboxylate 5-hydroxytryptophan to serotonin. That is another function of this non-specific decarboxylase. Now, this non-specific decarboxylase is also inhibited by some of the drugs, and these drugs are carbidopa and benserazide. What happens to the dopamine? Dopamine is transported to the storage vesicles, and this transfer to the storage vesicles can be inhibited by reserpine, tetrabenazine, deutetrabenazine, and valbenazine. These are the drugs that inhibit the transfer of dopamine into storage vesicles. Into the storage vesicles, what is going on? Once the dopamine is transported to the storage vesicles, it is converted to noradrenaline by dopamine beta hydroxylase. And this dopamine beta hydroxylase is also can be inhibited by disulfiram. Now, in the storage vesicles, noradrenaline is basically synthesized. Then what is happening? The action of noradrenaline, it is terminated by the reuptake in the vesicles, and this reuptake in the vesicles can be inhibited by cocaine and tricyclic antidepressants. Thus, another mechanism of termination of the action of noradrenaline is by its metabolism through MAO, monoamine oxidase, and COMT. Now further, what happens? Noradrenaline is converted to adrenaline. This step of conversion of noradrenaline to adrenaline is carried out in the adrenal medulla. This is a kind of a methylation step, and it occurs in the cytoplasm by what enzyme? Phenylethanolamine N-methyl transferase. I repeat, phenylethanolamine N-methyl transferase. And why it is occurring in the adrenal medulla? Because this enzyme, the specific enzyme, phenylethanolamine N-methyl transferase, is not present in the sympathetic neurons. So there only noradrenaline is synthesized. Up to that level, the synthesis occurs. The conversion of noradrenaline into adrenaline always occurs in the adrenal medulla. Hope you got all the basic points, the important highlighted things. Everything right into your mind. Let's move further. What happens? Noradrenaline remains stored in the vesicles, and stimulation of this neuron by the action potential increases the influx of the calcium, and that results in the exocytosis of noradrenaline into the synapse. Now, this exocytosis can also be inhibited by certain substances, and these are beryllium and guanethidine. Noradrenaline, which is released into the synaptic cleft, it acts on the postsynaptic receptors, and then it produces various kinds of actions, effects. It can also act on the presynaptic receptors, and it can modulate its own release by the feedback inhibition mechanism. And you can find beautiful diagrams in all the books that show this particular process with all the highlights and all the labelings of the main substances, their important associated enzymes and the inhibitors of the enzymes. Next, let's move on to the actions of the sympathetic system. First, let's talk about the heart. In the heart, the sympathetic system action is positive, chronotropic, ionotropic and bromotropic, and that is mainly owing to the stimulation or the excitation of the beta-1 receptors. What happens in the blood vessels? There is stimulation of alpha-1 receptors, and that leads to vasoconstriction. But when there is effect and stimulation and excitation of the beta-2 receptors, that leads to the dilatation of the blood vessels. Now, this sympathetic system effects, it depends upon the type of the receptor that is dominant in a particular area or organ. We have to find out whether alpha-1 is present in dominance or beta-2 in a particular vascular bed. Let's see the differences. Skin, mucosal and splanchnic blood vessels, they have a predominance of alpha-1 receptors, so their vasoconstriction is the main effect. While there is a difference in the skeletal muscular blood vessels and coronaries, there the beta-2 receptors are in much maximum amount, and there the vasodilatation occurs in predominance. What happens in the renal vessels? The renal vessels, they contain both the alpha-1 and the D1. Alpha-1 are the vasoconstrictor and D1 are the vasodilator receptors. So, in the renal blood vessels, the sympathetic stimulation, it causes less increase in the vascular resistance than in the other vascular beds. That is an advantage because of the predominance of both the receptor kinds. Let's talk about the effects on the GIT. The smooth muscles of the GIT, they are relaxed by direct action of the beta-2 receptors. And there is also an indirect action of the alpha-2 receptors. The alpha-2 receptors, they are present presynaptically. They are the heteroceptors and they are present presynaptically on the cholinergic neurons. And that is why they result in decrease in the release of the acetylcholine. Next, let's talk about the urinary system. Urinary retention can occur. Why? Due to the relaxation by the detrusor beta-2 action. And there is also a contraction of the trigone sphincter, and that is an alpha-1 action. What happens in the genital system or the reproductive system? If the lady is pregnant, then the pregnant uterus is relaxed by the beta-2 stimulation. And what is the alpha-1 action? The alpha-1 receptors in the vas deferens seminal vesicle, they all facilitate ejaculation. What is the effect in the bronchus? The bronchial smooth muscles, they contain the beta-2 receptors, but they have no sympathetic supply. So what is the action or what is the final effect here? The exogenous drugs, whatever you are giving the drugs from the outside, they cause bronchodilation. Why? Because they are acting only on the beta-2 receptors. The mucosal vasoconstriction, that is an alpha-1 action. It further increases the luminal diameter of the bronchus. All in all, there is a bronchodilation. What is the effect in the eye? That is ophthalmic effects. The alpha-1 receptors, they are found here. So stimulation of the alpha-1 receptors, which are found on the dilator pupillary muscles, that leads to mydriasis. The ciliary vasodilatation occurs due to the excitation and the stimulation of the beta-2 receptors, and that leads to more formation of the aqueous humor, while the opposite effect is of the alpha effect, that is the alpha effect decreases the secretion of the aqueous humor. So beta blockers, just remember this line, beta blockers, alpha agonist, they are useful in the treatment of glaucoma, that we will be doing a separate topic. What about the effect on the glands? Secretion of the salivary glands become very thick. The sweating, it is stimulated by the sympathetic cholinergic receptors, and that is which receptors? M3 receptors. This is an M3 action. Sweating is related to the M3 receptors. Now let's talk about the metabolic effects. The beta 3 receptors, they are stimulated and they cause the breakdown of the triglycerides, and that leads to the formation of more free fatty acids. Hyperglycemia is caused. Why? Because of the two processes, glycogenolysis, gluconeogenesis. And that is all due to beta 2 stimulation. What is the basic process? There is an efflux of potassium from the liver. That is hyperkalemia. That is the initial step. Now this hyperkalemia, finally it is followed by hypokalemia. That is the next step, because this potassium is uptaken by the skeletal muscles. Now, alpha 2 stimulation can also lead to hyperglycemia. And how this occurs? The insulin release is decreased from the beta cells of the pancreas. Little stimulation of the beta 2 glucagon secretion, and that is also responsible for the hyperglycemia or the blood glucose level rise. That you need to remember all these receptors, their effects, and what is the final effect. Other effects that can occur due to sympathetic stimulation. The beta 1 receptors in the juxtaglomerular cells of the kidney, they are stimulated, they cause the renin release. And the beta 2 stimulation can also cause other effects like tremors. That is a side effect. Okay, I will give a quick. Alpha and beta receptors, they are the major headings. Alpha receptors can be alpha 1 and alpha 2. Further thinning down in the classification, let's get to know about them also. The alpha 1 receptors can be of two types, alpha 1A, which are found in the eye and the prostatic urethra. The other type of alpha 1 receptors are alpha 1B oblique 1B that are found in the blood vessels. Alpha 2 receptors can be presynaptic or postsynaptic. If they are presynaptic, they will decrease the sympathetic system. They will act like a brake to the sympathetic system. The postsynaptic receptors, they are mainly found in the brain and the blood vessel. That is the whole classification of the alpha receptors. Coming over to the beta receptors, they can be of three types, beta 1, beta 2 and beta 3. Beta 1, they are found in the heart and the juxtaglomerular cells of the kidney. Beta 2 receptors, they are found in the lungs, in the bronchi, GIT, urinary bladder, uterus, liver, skeletal muscles, spindles and blood vessels. And last but not the least, to sign up and to wind up today's episode, let's get to know about the beta 3 receptors. They are found in the adipose tissue, coronary vessels and urinary bladder. With this statement, I cease my speech here, and just the last words I want to tell you is, don't forget to hit the like button. Don't forget to like and subscribe and follow whatever platform you are consuming this episode. Thank you. Take care. Bye-bye. We'll be meeting soon to complete this crash course series. I'll be doing it up to 8. I'll be continuing with the normal episodes of Is Pharmacology Difficult, where we left. You remember? If you don't, I'll make you remind you very nicely. Thank you. Take care. Bye-bye.